see you're awake. I'm just going to fill out an intake form before we begin, okay? Okay. I know you answered some of these questions when you were admitted, but I just have to ask again just so we can ensure accuracy. So, can you first verify your first and last name and date of birth? Okay. Okay. Past medical conditions in the last 6 months, any chronic illnesses that you've been dealing with? No. Okay. Diabetes, hypertension, any hospitalizations aside from this one? Okay. What about any current medications that you're taking right now? Okay. And how many milligrams a day? Excellent. Okay. And frequency of taking them? Once in the morning, once in the evening. Okay. And are you having any issues with that? Okay. Any over-the-counter drugs? Ibuprofen. And a multi. Okay. Known allergies to food or medications? Okay. So let's go over your family history. I'm going to ask you some questions about your immediate family, okay? Any significant health issues with your mother? Okay, good. Father? Okay. Okay, glad to hear that's going better. Okay. Siblings? Extended family? Okay. Okay. Any occupation-related health concerns? Anything at work that is giving you any kind of pain, causing you psychological distress? No. Okay. Good. Do you feel safe at home? Okay. What is your level of stress, would you say? Okay. Any major life transitions that you're going through? Okay. So now that we have that out of the way, I'm going to set this aside, pop on some gloves, and we're going to take your vitals, okay? Do you have any questions? Okay, well if you do, just let me know throughout the exam, okay? Okay. Okay, I'm going to start just by listening to your heart and your lungs, okay? Go ahead and just breathe normally for me for now. Okay. Okay. Listen on the Bedside for murmurs. Everything sounds normal so far. Okay. I'm going to listen to the sides. Okay. Go ahead and take a deep breath in for me. Good. One more time. Deep breath in and out. Excellent. Going to just listen to this side. So you're doing great. Just keep breathing in and out very deeply. In, 2, 3, and relax. 2, 3. Okay. And in, 2, 3, and out. 2, 3. Excellent. Okay. Go ahead and make note of that. Okay. All right. Next, I'm going to go ahead and slide this up your arm just to get your blood pressure, okay? Are you still comfortable? Okay, good. Just sliding this up. All right. I'm just going to be coming a little bit closer. Okay. 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 Beautiful. That is 120 over 72. Fantastic. Okay. Let's set that aside. Okay. Just going to grab your temperature and your oxygenation. So just stay still for me. Okay. Excellent. No fever. And just go ahead and give me your index finger here. Okay, your heart rate is 82 beats per minute. Oxygenation is 99% at room air. Okay. I said 99, right? Okay. Okay, so your vitals are all doing good. A lot better since when you were first admitted. So that's really good. So if you don't mind, I'm just going to be coming a little bit closer. I want to palpate your head and neck, just feeling along the cervical spine as well, to make sure there's no lumps or bumps or contusions. I know that when you were admitted, we didn't find anything, but you did have that fall. Okay, so we just want to stay on top of that to make sure there are no latent growths. Okay, just going to be touching the sides of your face. Okay, good. Go ahead and open and close your mouth for me. Good. Okay. I'll be placing my hand right here in your jaw. Go ahead and try to open your jaw for me. Open your mouth. Good. Was that painful at all? Okay. I'm going to be feeling the sides of your ears. Open and close your mouth for me. I'm listening for any clicking or popping. So open and close. Very good. Just feeling the preauricular lymph nodes and postauriculars. Feeling for any palpability in the nodes. None here. Okay. Raise your eyebrows for me. High as you can go. Good. Now keep them high and try to close them in 3, 2, 1. Okay, good. Now scrunch them down. Okay, good. Smile for me. Show me all your teeth. Alright, wide. Alright, excellent. I'm going to go ahead and take a look inside your mouth just to see if there's any bacterial abnormalities, okay? But continue to relax. Wide for me. Say ah. Okay. I'm not seeing anything to be too concerned with. Open a little bit wider. Your mouth is a little bit dry, so we are going to bring in some water for you. Do you feel thirsty right now? Okay. But no discoloration of the gums. They're pink like they should be, just a little bit dry. Open a little bit wider. Go ahead and say ah. Good. Okay. Okay. I'm just going to take a sample as well. Okay, open your mouth. Beautiful. Okay, I'm gonna go ahead and just feel your face, okay? Just touching gently, feeling for any edema of the face. You're sweating just a little bit. I'm gonna go ahead and look and see on the skin. Okay. The skin looks very healthy. No discoloration of the face. I'm gonna look over on this side as well. Go ahead and turn your head just a little bit this way. Perfect. Just looking down the corner. Okay. Okay, go ahead and look the other way. Okay, I'm just going to be touching your jaw right here. Just feeling a little bit, looking at a little bit of discoloration. Does that feel normal to you? Was it painful? Just when I touch you on your jaw. That feels normal, okay. What about right here? Okay. I'm just gonna draw my finger right from the neck all the way to the chin. I want you to let me know if you feel any abnormalities there, any points of numbness. Good. Okay, let's do the other side. Let me know if you feel any numbness. Okay, excellent. Okay. I'm going to do a pressure point test. Let me know if you feel 1 or 2 pressure points, okay? Hold still. Good. Good. No peeking? Okay. And go ahead and keep your eyes closed. I'm going to be using a brush. You're going to feel a soft sensation. Let me know if you feel it on the left or the right side of your face, okay? Good. 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 Excellent. Excellent, okay. Just going to make a quick note of that. Okay, and very quickly, I'm just going to look at just the top of your scalp, okay? I'm just going to check here and see. You got some hair here. Okay, give me one moment. Just going to, there you go. You got some fuzz right on the top of your head. sure we don't see any infestations or lice. So just hold still. You're doing really good. Okay. Okay, I'm just gonna look here and see. Do you feel itching at all? No history of dandruff or scalp issues? Okay. Okay. I don't see anything here. I'm just going to, if you could turn your head this way, I'm just going to look at the side of the scalp. Okay. Okay, try to hold still. Good. Just gonna check here, no debris. Okay, I don't think we have anything to worry about there, so that's good. Okay, let's go ahead and do an eye exam. All right, how's your vision right now? Good. Do you have any contacts or glasses in? Okay. We'll go ahead and do your very best. I'm going to just back up just a little bit. Try to just like roll right at my nose. Good. Let me know when the light enters your field of vision. Say now. Good. Good. Now let me know when the light leaves your field of vision. Say now. Good. Okay. And are you dizzy after looking at that? Okay. All right. Now look at both my fingers. Let me know which are further away. The ones on your left or your right? Your left. Good. All right. Which fingers are moving? I'm going to bring them a little bit closer. You don't have to do anything. Just look straight ahead. Let me know which fingers are moving. Excellent. Both. Good. Very good. Okay. Go ahead and look at your eyes now. So go ahead and look straight ahead for me. Find a point. Okay, I'm just coming a little bit closer here. Pupils round and reactive. I don't see any issues here. Excellent. I'm going to look at the other eye. Okay, look to your left. Look to your right. Look up. Look down. Now roll your eyes. Excellent. Okay. Do you have any history of blurry vision, double vision? Okay. Dizziness on standing? Okay, good. All right. Just want to test your perception of color. What color is my shirt? And this bra strap? Good. Okay. What color is this red? What color is this? Good. What color is this? Okay, I gave you a little hint. Let's do that again. What's this color? What's this color? Good. Which circle is larger, number 7 or number 5? Good. Number 5 or number 6? Good. Can you read this row for me, beginning with the D? Good. Can you read it backwards? Okay, I'm going to bring it a little bit closer. Go ahead and try that again. good. What about that last row right here? What is that? Excellent. Okay, so your eyes seem pretty healthy to me. No issues here. Going to look inside your ears now. We're going to do some hearing tests as well. You've been a little bit slow in reaction, and I've looked at your notes, and you've been having a little bit of issues with that. No worries. Go ahead and turn your head this way. I'm just going to look straight inside the eye, the ear. Okay. Okay, your tympanic membrane looks slightly swollen. A lot of wax build up. Okay, go ahead and just turn the other way. Good. Okay. Same thing here. Membrane looks slightly irritated. No signs of major infection, just some irritation. Okay. I think from the accident you might have had a little bit of trauma to your ear. Not to worry. I'm just going to go ahead and see if I can clean that up for you. Okay, you don't have to do anything. I'm just going to be using a tool to gently scrape out some of the wax. Okay. Okay. Go ahead and turn your ear. Okay, just getting in there. Gently just scraping out some of the issues that I see here. Does that feel a little tingly? Okay. That's okay. Okay, and we got some, definitely. Okay. Okay, we're gonna do that again. Go ahead and turn and show me your other ear. Go ahead and turn. Okay, just scraping that off. Just gonna use the light again here. Just gonna go ahead and bring this under the tip. Okay. Alright. Okay, really getting in there. Okay. So that should help with some of the irritation. I'm going to go ahead and use some eardrops as well. Go ahead and lean your head this way, just like that. Okay, this is going to be very soothing and it's going to help your ears to be more clean. Good. Okay, go ahead and turn the other way. Okay. Okay, and just hold your head just like that, okay? Just for 5 seconds, just let it sink in. I'm glad you can hear better. I'm gonna do a few tests just to ensure that, but I think that that's going to be very helpful to you, okay? You still comfortable? Okay. Okay. So, this is gonna be your peripheral hearing. I'm gonna actually be placing it on your chest. I want you to let me know when the sound stops. Good. All right. Okay. Next, I want you to let me know which sound is louder to you, A or B? A. B. Good. A or B? Good. A or B? test. I'm going to come a little bit closer and just whisper some things in your ear. July, Christmas, beaches, apple, good, castle, good, winter, excellent, storybook, good, broomstick, excellent. So as long as your ears feel like they're soothed, I think it's a good point to move on, okay? So I'm going to go ahead and put this aside. We're going to do a quick taste test. Okay. Okay, go ahead and open, close, open. What does that taste like to you? Very excellent. Okay, I'm going to do one more. Okay, open, close, open. What does that taste like to you? Peppermint. Good. Okay. And I have a couple more droppers. I promise you these are not the eardrops. These are just for taste. Go ahead and open your mouth and focus on exactly what this drop tastes like as it enters your tongue. Cinnamon, yes. Cotton candy, perfect. Okay. So, I'm pretty happy with this so far. I think that your cranial nerves are all coming out normal. I'm going to go ahead and do an abdominal exam if I have your permission. Okay, okay. And do you mind if I peel the blanket back? Okay, I'm just going to go ahead and take a listen. You're still comfortable, right? Okay. Okay. Sorry, it's a little cold. You're gonna just breathe normally. Good. Okay. Okay, everything sounds normal. Okay. I'm just gonna set this aside actually. Alright. Just feeling for any abnormal lumps or bumps. Okay. Any pain here? Okay. Pain here? Alright, what about here? Okay, I'm just gonna go a little bit lower and feel the lymph nodes. Okay, non-palpable. Very good. Okay, gonna feel your legs real quick. Feeling for any swelling. Go ahead and close your eyes. Let me know which leg I'm squeezing, your left or your right. Good. 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 Okay, good. Down to your ankles, I'm just feeling. Okay, excellent. I'm going to do another sensory test. We're going to do a pressure point test again, this time on the abdomen. Go ahead and let me know if you feel 1 or 2 pressure points. Say 1 or 2. Keep those eyes closed, okay? Good. Okay. And let me know if you feel it on your right or your left side. You're doing really good. 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 Okay, excellent. Okay. Do you mind if I set this on your chest? Okay. So we are all finished with the exam. You did great. I'm just going to write down what we did with your ears. Okay, so I'm going to come back in actually in the morning and we're going to do a very abbreviated version of this test. Do you have any questions for me right now? Okay. Okay, I'm going to go ahead and turn off the light and let you sleep, and I'll see you in the morning. Okay, I'll see you bright and early. Bye.